Now let's start with our disease burden as a country. How daunting is this burden?
Well, you see, every health system has to deal with diseases. So when I'm asked how daunting is our disease burden, I say we have a unique disease burden. And what do I mean by unique disease burden? Traditionally, countries around the Sahara, and in fact, most health systems started traditionally that way, that they had to deal with communicable disease. So in Ghana, what do we mean by communicable diseases? We mean our malarias, our typhoids, our respiratory tract infections, our viral infections, and all that, HIV, you control of them. Those that you need a vector or something like that to contrast. And then you have what we call the non-communicable diseases that start creeping in often when you start aging. Generally, when you go past the third decade of life, they start gradually creeping in. But what do we see in Ghana? Because we haven't managed to get rid of a lot of our communicable diseases, there's a doubling of our disease burden. So that is what we are trying to deal with. That is what our health system has to try and address. So I'll break it down this way. Let's look at something like the communicable disease. Everyone would know that malaria is something. I mean, we are talking about dengue fever now in Ghana. Everyone knows that malaria, and that's why a lot of the symptoms of dengue are similar to malaria. So a lot of people who try to self-medicate, which they shouldn't under these circumstances because of dengue, try to treat malaria. And why are they doing so? If you look at Ghana's health service data, it will tell you that 30%. So when you go to an OPD in Ghana, 1 in 3 of the people who is sitting there is there because they have malaria. And then when you go into the wards, 40% of the people who have been actually admitted and are being treated as inpatients are there because of malaria. This comes from the Ghana Health Service report of 2020. Then there is HIV. It's still there. The prevalence rate is about 1.7% of our population. So if you look at a year like 2022, you'd say that almost 350,000 Ghanaians were living with HIV or AIDS. And so when that happens, you have an issue. Then there's tuberculosis, which in most countries now is gone, but still there in Ghana. You would realize that there are about 152 cases per every 100,000 of the population. So you see, that is the first point. Do our political parties factor this in when they write their manifestos and they want to address our health issues? And why do I ask the question? Recently, we heard that medication that had been donated to Ghana by the Global Fund had been sat at Tema for over a year and wasn't being cleared. So if this is what our disease burden for communicable diseases is, you wonder how the people who were sat there while this was happening were sleeping. And so and then the question I ask myself is, while they were sleeping, while these medications sat there, did the citizenry also know that this is our disease burden and that this was a scourge on our integrity as a country? So that is our communicable disease burden. But then you realize I'm giving the top line figures, but you still have the typhoid fevers, the amoebic dysenteries, the diarrheas, all still being part of our communicable disease.